Hi everyone, I am Prof.Manavalam. In this video, we are going to see about the cardiotocography part 2. It is a continuation of cardiotocography part 1. In this part 2, we are going to see about the baseline fetal heart and variability in the fetal heart. At the same time, any changes that occurs in the baseline fetal heart rate, what will be happening to the fetus, that we are going to see in this video. Baseline fetal heart. It is the average heart rate that fetus has. It is commonly shown in this cardiotocography machine in 10 minutes window period. According to this graph sheet, it is the baseline fetal heart rate is 120 beats per minute. According to this graph sheet. Actually, the normal fetal heart rate, baseline fetal heart rate is between 110 to 160 beats per minute. Next, move on to if any variation that is happening in the baseline fetal heart rate, it is termed as a fetal tachycardia and a fetal bradycardia. So, fetal tachycardia means nothing but the baseline fetal heart rate, it is increasing more than 160 beats per minute, means it is indicating the fetal tachycardia. There are many reasons for the development of fetal tachycardia. And the first one is the fetal hypoxia. Whenever the fetus doesn't get the adequate amount of oxygen supply because of some placental insufficiency, automatically there is a variation in the fetal heart rate. Second one is chorioamnitis. It is the inflammation or infection of the amniotic cavity that is around the fetus. So it is automatically has a direct influence on the fetal heart rate. Next, endocrine disorders, that is hyperthyroidism. It has the direct effect on the fetal heart rate. Or fetal or maternal, the mother is affected by the anemia, means automatically the blood hemoglobin concentration which will be getting reduced. So hemoglobin, it is the hemoglobin is very essential to carry the oxygen. So oxygen supply automatically it gets reduced to the fetus. So the fetus end up with a variation in the fetal heart rate. It may be a fetal tachycardia. Next, in case of fetal tachyarrhythmia, the fetus may experience the tachycardic symptoms. Next, move on to the fetal bradycardia. So it is defined as the baseline fetal heart rate. It is less than 110 beats per minute. So this is called as a fetal bradycardia. It is also one kind of abnormality. It is very common to have the baseline fetal heart between 100 to 120 beats per minute in this certain situation. Take as an example of post-date gestation. The gestation weeks, it is going beyond 42 weeks, means then it is called as a post-date gestation. In that condition, there is a variation in the fetal heart rate. Next, the malpresentation. In case of transverse presentation or malposition, occipito-posterior position, there may be a variation in the fetal heart rate. Sometimes there may be a severe or prolonged bradycardia. The readings are less than 80 beats per minute for more than 3 minutes period of time. It is mainly indicating the presence of severe hypoxia for the fetus. Next, move on to the causes of prolonged or severe type of bradycardia. The first reason, it may be because of prolonged cord compression. It occurs if the while the fetal head is descending down during the time of uterine contraction, or in case of, it is commonly present in case of low-lying placenta. Second one is cord prolapse. It is also commonly present in case of low-lying placenta or in case of multiple pregnancy. And there is a chance of fetal bradycardia because of exposing of the cord outside the vagina. Next, epidural or spinal anesthesia. The mother had any epidural or spinal anesthesia during the time of labor in order to ease the pain experienced by the mother during labor. It has automatically crossed the placental barrier and it affects, it gives the triangular effect to the fetus. So there is a variation in the fetal heart rate. Next, maternal seizure. For this, They commonly used to administer magnesium sulfate. It has the effect on the fetal heart rate. Next, instead of the fetus descending down or coming down into the lower uterine segment during the time of later weeks of pregnancy or during the time of labor, instead of coming slowly, if it is occurs in the fast manner, in a rapid manner, means there is a chance of fetal bradycardia because of placental insufficiency. Next, move on to the baseline variability. There is a variation in the baseline fetal heart rate by beats by beat. That is called as a baseline variability. It is indicating that, or it shows that there is a great induction between the, or it is a interaction between the nervous system, chemoreceptor, baroreceptor, and adaptive cardiomechanism. So everything it is intact, the nervous system is intact, means definitely the fetus experience baseline variability in the that is present in the fetal heart rate. It may be the baseline variability, it may be between 5 to 25 beats per minute. So baseline variability, it is the, already I said, it's the variation of the fetal heart rate from beats to beat. How we have to interpret the baseline variability means, the interpretation they have given in three ways. First one is reassuring, it is indicating the fetus is healthy. Non-reassuring means, so the fetus is needs some attention. Abnormal means it is indicating that the fetus need immediate or emergency attention in order to save the life. First, reassuring, it is the indicating, or the baseline variability is come between the 5 to 25 beats per minute. In case of non-reassuring, it may be a less than 5 beats per minute for between 30 to 50 minutes period of time, or more than 25 beats per minute over the period of 15 to 25 minutes. In case of abnormal means, less than 5 beats per minute, more than 50 minutes period of time it is present, means it is indicating it is abnormal. Usually in case of sometimes the fetus is sleeping, means there is a changes, there is no variability which will be present. But the fetus, it takes only 40 minutes duration of period for its sleep. So after that also there is a variation, there is no variability, means it is indicating abnormality. In case of more than 25 beats per minute, it is also present more than 25 minutes, means that is also indicating abnormal. In sometimes sinusoidal pattern, there is no variation in the beats to, there is no beats to beats variation of the fetal heart rate, means that is called as a sinusoidal pattern. So in which are all the cases the variability which will be getting reduced, means while the fetus is sleeping, means the time there is a changes are reduced, there is a chance of reduction of fetal variability. Fetal acidosis is happening because of fetal hypoxia. Fetal tachycardia, sometimes the mother had the drugs like opioid, benzodiazepine or methyl dopa or magnesium sulfate for maternal condition or to ease the pain during the time of labor. These are all the medication they are commonly administering to the mother. In case of magnesium sulfate for eclampsia and uncontrolled pre-eclampsia, methyl dopa for pre-eclampsia. So all these drugs readily it is cross the placental barrier, it affects the fetal cardiac system. Next, in case of prematurity, the cardiac system it is not having that much of adaptability for the variation. So there is a higher chance of reduction of the fetal variability, especially the gestational age lesser than 28 weeks of gestation. Thank you all.